Are ultrasound scans safe in pregnancy? Yes, they are. Hi, I am Dr. Srinivas Rao, obstetrician and gynecologist at Irons Hospital, Indiranagar, Bangalore. How many times should I have an ultrasound scan? When should I have an ultrasound scan if I am pregnant? This is the question which most women who have become pregnant for the first time generally experience. Meet your gynecologist and he or she will explain to you when and why an ultrasound scan is required and how many times ultrasound scans are required during pregnancy. Ultrasound scanning has really improved the study of the pregnancy too. It has improved substantially the monitoring of the pregnancy, and it has really helped in understanding the well-being of the fetus. As soon as you realize that you are pregnant, you're likely to miss your periods. This is the time you must definitely have an ultrasound scan. Early ultrasound scans are usually performed by the transvaginal route so that the pregnancy can be visualized up close and a diagnosis of an intrauterine pregnancy can be made. Sometimes extrauterine or ectopic pregnancies may occur. So a scan as early as possible when you suspect a pregnancy is really vital. After you have diagnosed the pregnancy through an ultrasound scan and you've realized that the pregnancy is growing nicely, first the gestational sac has appeared, then the yolk sac has appeared, then a fetal pole has appeared, and thereafter the fetal cardiac activity also has appeared. Thereafter, at around 12 to 13 weeks of pregnancy, a screening ultrasound is performed in order to rule out any soft ultrasound markers for certain chromosomal abnormalities like Down syndrome. So, a nuchal translucency scan is performed at around 12 to 13 weeks, and thereafter your doctor will advise you to undergo a biochemical marker testing also, and thereafter decide what is the risk factor for having a chromosomal abnormality. The next important scan is at around 19 to 20 weeks of pregnancy, wherein the entire fetus is scanned to see if there are any structural abnormalities, any fetal anomalies which are not compatible to life. Thereafter, generally scans are not required for at least another 8 to 10 weeks of time. At around 28 to 32 weeks of pregnancy, a interval growth scan is performed to see how the baby has grown between 20 weeks and 30 weeks, to also understand whether the amniotic fluid quantity is normal, to look at the placenta, what is the grading and maturity of the placenta. A scan is performed between 28 to 32 weeks of time. If in case there is any reduction in the growth parameters of the baby, then action can be taken in order to improve that. Ideally, thereafter, a scan between 36 to 37 weeks is recommended to understand the biophysical profile of the baby, to see if the baby's movements are fine, if the baby's muscular tone is good, if baby is having breathing movements inside, and to also see if the amniotic fluid is adequate. Then color Doppler studies are done in order to see the flows of the blood flow in between the baby, between the mother and the baby is checked in order to understand how the growth and how the well-being of the baby is. So, ultrasound is very safe, and these are the 5 minimum ultrasound scans you must perform today, and most of the gynecologists do advise these if they are practicing modern day obstetrics. And don't be worried about ultrasound scans, they are useful. Please get them done on time. If you liked this video, please share and subscribe so that somebody somewhere really benefits from this. Watch this space for my next video. Thank you.